The first thing I'm going to do in the medication room is to verify the doctor order against the MAR to see if it's the same. Next, I'm going to wash my hands and then pull the medications. The doctor has ordered 20 units of NPH insulin sub-Q now and 25 milligrams of Phenergan IM now. The pertinent lab information for insulin includes looking at the last blood sugar reading, and for Phenergan, we need to ask why the patient is nauseated. Other things I'm going to look at include looking at the medical history of the patient, the medication history, any known allergies, and height, weight, and age of the patient. The first check of the medication includes looking at the vial, checking the expiration dates, and the integrity of each vial. The first vial we're going to look at is the NPH insulin. Since it is NPH, we need to roll the vial in between our hands to mix the contents before drawing up the medication. The expiration date reads 2 of 2028, and the integrity of the vial appears to be in good condition. The next vial is the Phenergan. The label reads 25 milligrams per 1 milliliter. The expiration date reads 8 of 2027, and the integrity of the vial appears to be in good condition. Now we're going to draw up our medications. The first medication we're going to draw up is for the insulin. The first thing we need to do is wipe off the top of our vial with an alcohol prep pad. Since the order read for 20 units of insulin, we need to first draw up 20 units of air into our syringe, being careful not to touch the plunger of the syringe because it is sterile. We'll inject the air into our vial, flip it over to draw up 20 units of insulin, recap our needle, and tap out all the air bubbles as best we can from the syringe. The next medication we're going to draw up is the Phenergan. Again, the doctor ordered 25 milligrams, but our label reads 25 milligrams per 1 milliliter of medication. So we're going to pull up 1 milliliter of medication. First, again, we're going to wipe off the top of our vial using an alcohol prep pad. And we're going to pull up 1 milliliter of air to begin with. Again, being careful not to touch the plunger of our syringe because it is sterile. We're going to insert the air into the vial, flip it over to draw up the medication. Recap our needle. And tap out the air bubbles as best we can. Now I'm going to switch this needle with the needle that we're going to use in the patient's room for the IM injection. We'll untwist this needle, dispose of it into the sharps container, and now without touching the adapter of this syringe and the hub of this new needle, we will connect the two pieces. Now it's ready for the patient's room. Now we're going to do the second check of the medication. We're going to check our MAR, we're going to check our vials, and we're going to check our syringes. Before we leave the medication room, I'm going to have another nurse double check for accuracy my syringes to make sure that I have the correct medication and the correct dosage of the medication. Now I'm going to take all my supplies to the patient's room. I'm going to bring my gloves, I'm going to bring my vial, I'm going to bring my syringes, and I'm going to bring my MAR. I'm going to knock on the door and introduce myself to the patient. I'm going to tell them what I'm there to do. I'm going to wash my hands, and I'm going to identify the patient using two identifiers. While I check their wristband, they're going to tell me their full name and date of birth, and I'm going to do the medication check for the third time. I'm going to check the MAR, check my vials, and check my syringes. I'm going to ask the client if they have any known allergies, and I'm going to assess their level of alertness by asking them where they are, who they are, and what today's date is. And then I'm going to assess their knowledge of the medication. I'm going to ask them what do they know what these medicines are for and why they're receiving them? I'm going to ask them when they last received them and where on their body they last received the medicine. I'm also going to assess the lower extremity movement to see if they're able to move their hips and their legs for the injection. And then I'm going to delegate assistance if needed. And then we're going to put on our gloves. While I do that, I'll tell you where we can inject the IM and sub-Q injections. For IM, there are 3 places where we can insert the injection: the deltoid, the vastus lateralis, and the ventral gluteal. Today we're going to insert the injection into the vastus lateralis. The landmarks include 4 fingers above the patella and 4 fingers below the greater trochanter. For sub-Q, there are 2 places where we can insert the injection: the lateral side of the upper arm and the abdomen, 2 inches away from the umbilicus. We are going to be giving our injection sub-Q into the abdomen because it's the preferred site of the insulin injection. The first injection we're going to give is the IM injection. We're going to rotate from the last given injection site, which our patient told us that they received the last injection, into their left vastus lateralis. Therefore, we're going to insert the IM injection into their right-sided vastus lateralis. We're going to make sure that we're using the appropriate size needle. In this case, we're using a 1.5 inch needle. We're going to inspect the skin and palpate for bruises. We're going to ask the patient if they're in a comfortable position and to relax the site where it's going to be given. I'm going to take an alcohol prep pad and clean the area from inside outward. And for today's injection, we're going to use the Z-Track method and stabilize the needle with my non-dominant hand. First, I'm going to loosen up the cap of my needle. And then I'm going to pull the skin taut with my non-dominant hand and insert the needle at a 90-degree angle. Once the needle is inserted, I'm going to stabilize the needle with my non-dominant hand and insert the medication over 5 to 10 seconds. Once all the medication is inserted, I'm going to leave the needle in for a few seconds to ensure no medication gets on the skin. I'm going to release the needle, release my hand, and place a gauze pad over the injection site without massaging the area, and then immediately disposing of the needle into the sharps container. The next injection that we are going to give is the sub-Q. Again, we're going to rotate from the last given site, which the patient told us she received the last site, into her left upper quadrant of her abdomen. Therefore, we're going to inject this into the right upper quadrant of her abdomen, again 2 inches away from the umbilicus. We're going to make sure that our patient is comfortable position and relax the site we're given, and we're also going to inspect and palpate the area for bruises. This time we're going to give the shot into 2 inches of skin, and I'm going to insert the needle at a 90-degree angle because the patient is overweight. First, we're going to wipe the area clean using an alcohol prep pad from the inside outward motion. We're going to loosen the cap of our needle. We're going to grab 2 inches of skin, insert at 90-degree angle, release my hands, stabilize with my non-dominant hand, and insert the medication over 5 to 10 seconds. Release my hand, release the needle, and place a gauze pad over the injection site, and immediately take my needle to the sharps container to dispose of it. Next is our evaluation. We're going to clean our area. I'm going to remove my gloves. I'm going to wash my hands. I'm going to put the bed in its lowest position. I'm going to put the side rails up ×2. I'm going to put the call bell next to the patient. I'm going to assess their level of pain and their level of comfort. I'm going to inspect and palpate each injection site for lumps, bruises, swelling, tenderness, redness, and then I'm going to document that I gave the medications onto the MAR. And we're finished.